Hi, so this is a presentation on virtual reality and psychology by Angie Cordova and Caitlin Franklin. So for the introduction, I kind of want to talk about how does virtual reality work in psychology. So virtual reality stimulates situation and social interactions. Our brains takes input artificial or real from both eyes to create a 3D mental representation. They add sensory information such as auditory stimuli, which enters through both ears to create a 3D spatial surround sound. They also have haptic feedback, which creates a sensation of physical contact with the virtual world. And then virtual reality and psychology can be used as a tool for research and therapy. For example, for therapy, there's exposure therapy that targets behaviors such as avoidance that people show in situations or memories where they are frightened or have anxiety. The goal of the therapy is to diminish that avoidance behavior by confronting the things that the person fears, which will help them lessen that behavior. And then for the research tool, it can be a practical tool that assists in studying and measuring human behavior and cognition. The central goal of the research tool is to understand real-life human behavior. And virtual reality and psychology could be used as treatment for mental health diseases such as depression, anxiety, PTSD, phobias, by also making them feel safe and in a controlled environment with ecologically valid situations. VR can also be cost-effective, meaning that it could be costly, but you're kind of getting what you're paying for, especially because the treatment is proven to help patients and improve the mental health diseases that they're experiencing. So VR and treatment for anxiety is a form of exposure therapy, and as previously mentioned in the introduction, exposure therapy targets behavior, most often such as anxiety or avoidance. So they put them in situations or memories that make them feel frightened or anxious, but the goal is to diminish that behavior by confronting them. So the patients are exposed to what they fear, and from that they learn that anxiety and fear will lessen on their own. So patients who participate usually have PTSD, phobias, and anxiety. Also, they have substance abuse sometimes, which helps them. So examples of virtual reality and treatment for anxiety. I mentioned that most of the patients who do this treatment are people with PTSD, phobias, and substance abuse. So the first example would be a veteran with PTSD. He or she is put in a stimulation, kind of like a environment that's very similar to when they were in combat, that teaches them to try and diminish that anxiety or fear. A client with a phobia also is put in a situation that, let's say they're afraid of heights. So they are put like on the top of a building, very, very high, and they are taught, or they try to learn how to diminish that anxiety by slowly putting them in that situation. And then a client with substance abuse is put in an environment with similar to when they were taking drugs or consuming alcohol. They kind of put them in that situation, but they are learning to not be afraid of it. Virtual reality in treatment for depression is a form of cognitive behavior therapy. This refers to a diverse collection of therapeutic techniques that promote change in behavior and cognition. It's effective in reducing depressive symptoms, and it includes cognitive restructuring, where it's designed to identify cognitive patterns that cause a person to stay in a depressed mood, and then it modifies those moods. In cognitive restructuring, a patient has to imagine an example situation to extract and manipulate cognitions for exercise purposes. And it also involves behavior activation and physical activity. So this is a core part of cognitive behavior therapy. It causes a person to imagine themselves in a situation where they might feel more happy with natural reinforcers. So examples of virtual reality in treatment for depression is a client who has trouble with social skills. So in cognitive restructuring, you want to teach them through virtually how a person would look when they're talking to somebody, and how you can manipulate that and learn how to do it yourself. And then a client who has a low self-esteem. So in cognitive restructuring, you also can imagine in virtual reality like a black screen with terms that make you feel happy, such as I'm beautiful, or I'm worthy, stuff like that. You want to see it and you want to imagine it in your mind to make you feel more happy and less depressed. A client who needs embodiment experiences is also an example of virtual reality in treatment for depression. It's a part of the behavior activities and physical activities. The virtual reality can put a person like in a happy place, such as maybe they like hiking, but they're not able to because of some reasons, but the virtual reality puts them in that embodiment experience.
So the next example we are going to talk about is VR and spatial cognition research. Spatial cognition is one of the areas that has most benefited from the development and use of 3D computer technology like VR and AR. Virtual reality gives a high level of experimental control and precise data collection, and human versions of paradigms for animal subjects have been developed to compare human performance with other species. A few examples of VR and spatial cognition research include demonstrating existence of early developmental windows, where independent spatial experience are crucial for development of skills related to maze problem solving. Training in virtual reality was found to be about as effective as real exploration for establishing cognitive maps of environments. In a study comparing landmark and layout use in situations where virtual taxi drivers had to pick up customers at random points and transport them to virtual shopping malls, they used altered landmarks and buildings through VR, and were able to show that when layout and landmark information conflicted, landmarks are used preferentially. Another example of VR in psychology is VR in pain management. VR interventions have been used in acute pain management for over 2 decades. Due to pharmacological approaches causing many issues, including narrow therapeutic windows, adverse side effects, and drug misuse and dependence, VR-based interventions are becoming a lot more popular. The goals of this VR experience are to help patients self-regulate pain, distract from pain, and improve movement in chronic pain management. A few examples of VR in pain management are the different approaches used by the psychologist. The most common approach used is distraction, and this can be enhanced by using VR to induce positive emotions. This approach uses VR to draw the patient's attention to the computer-generated world, diverting the attention away from incoming pain signals. A more advanced form of the common approach is focus shifting. and this approach uses agency to improve engagement and shift of attention. In VR-focused shifting experiences, the user is required to interact with the virtual environment and achieve specific goals, and the person plays an active role in this change. A final mechanism used to induce VR analgesia is skill building, and this is the most advanced form. Analgesia uses VR to build the skills and competences needed to help individuals regulate their response to painful stimuli. Just like in focus shifting, the user plays an active role in their pain management. So in conclusion, virtual reality has many uses that help people in need, including treatments for depression, anxiety, PTSD, and different phobias. There are also many benefits to using virtual reality in the psychology field, and these benefits can be seen in pain management and in spatial cognition research. And there are numerous ways for virtual reality to be integrated into psychology research and treatments, as listed in the examples in this PowerPoint. Well, thank you so much, and I hope you enjoyed our PowerPoint and learned something new.